Okay, now put your name and your professor in the chat so it records. Okay. Ashley, do you want to turn your camera on? I don't know how to pronounce your name. I'm not even going to try it. Ashley, okay. Oh, Ashley, okay.
I can't get my video to come on for some reason. Like it says it's on, but it's a black screen.
Okay.
I don't know
Yeah,
why.
black screen. Okay, all right. Liamara? Liamara? There you are. How do you pronounce your first name?
Yeah, Mara.
Pardon me?
I was a keyword name, so Liat Mara.
Liat Mara. Okay. What a beautiful name.
Thank you.
All right. Well, we got a few more. Hang on.
When you make plans, then you have expectations. When you have expectations, then you will get disappointed.
Having expectations also gives you.
Sorry, just choked on my coffee. Yeah. Okay, so we'll get started. Welcome to all of you guys coming to exam 2 review. I hope you're already preparing for the exam. And you have the study guide. Do you have the study guide available? Okay.
Yes.
All the professors do reviews with different strategies. Some use PowerPoints, others use other techniques. I do my reviews from the study guide. So if you want to pull that out, we could take notes. Okay. For those of you that are coming in, just make sure you put your name and your professor in the chat. That'd be fantastic. Okay, so I'm going to try and share my screen. We'll pull up the study guide. See if that works. Can everybody see that? Okay, so we'll go through the study guide, and then I want to go through some test taking strategies for taking the exam. Okay, so we know that this exam is covering weeks 3 through 5. Okay, this is the same cover sheet that you have for your other study guide, so everything's pretty much the same. All sorts of questions, 75 minutes, general questions to review with regards to math, calculations, IB calculations, equivalence and conversions, setting up IB drip formulas. So you should have all received some math resources from your instructor. If you haven't, go ahead and ask. We have plenty of math resources, math tutorials that we send out to you. Okay. Always try and do as many math tutorials, and if you have issues with math and math questions, practice questions. We've done some case studies. So part of your preparing is case studies, levels of prevention in your chapters. The 3 things I always tell my students to make sure they have reviewed in each of the chapters is 3 things. One is the levels of prevention. Make sure you review the levels of prevention for each chapter, because each chapter gives you specific primary, tertiary, and primary, secondary, and tertiary interventions based on the topic or concept that's being covered in that chapter. Okay, so make sure you review those. Also review the Healthy People 2030 information in each chapter. There's a little box in each chapter. It talks about goals and objectives, again, specific to the chapter that's being covered. So have a look at that. And then I always tell my students at the very end of every chapter to that review section. Right? They have a review section that highlights the important parts of the chapter. Okay, and what I tell my students is always look at the objectives at the beginning of the chapter. That's what we're trying to get out of the chapter. If you are able to answer and articulate those objectives, you have a good understanding of the concept that was reviewed in that chapter. Does everybody know what I'm talking about? Okay. Please be mindful of priority questions. There's a lot of priority questions in all these exams. And as I do my reviews with students for exams, a lot of students miss the important cues in the question. Okay, whether it's a priority question, is it first? Is it the greatest? Is it the priority? You've got to be able to pull those cues out of the questions. Okay, and then always ADPI. Obviously, in nursing, we use ADPI in every setting we're in. In this particular class, we are using our ADPI in the community setting. So we are bringing all of our past knowledge from classes, from clinicals, from SIMS, from labs. We are bringing all that information together in this class, and we're moving out and taking care of clients in the community. Does that make sense? So you have to be able to use your ADPI in all of the different, like, for example, in with this exam, we're talking about rural population, we're talking about migrants. We have to be able to utilize our ADPI in very different ways in very different settings. Does that make sense? So you can't think of ADPI just doing an assessment of a clinical patient that you have in the hospital. You have to be able to articulate your ADPI out in the community. Because remember, obviously, clients are sick in the hospital, but there's also clients that come home and still require care. And that's where the community nurse comes in. Okay. So let's review some concepts, main concepts that were covered in weeks 3, 4, and 5. When you think of rural and migrant health, there's a lot of considerations to take into account. Okay, I'm not going to review every bullet here, but how I would like to attack the study guide is let's review the first bullet and then let's think of questions. What information are you being provided? What questions might be asked? Okay, so it's asking you to review the consequences of poverty in rural areas. So we give you a summary. The groups that are at highest risk are children, minority and racial ethnic groups, and single parent families, especially those headed by women. Among minority groups, Hispanics have an Hispanic rate is increased the most. Okay, although the education level of rural residents has increased, the number of college degrees remains lower than for the urban residents. Okay, and it's not surprising that unemployment remains high with the people who have least education. So that's a lot of information in that bullet. Okay, so let's think of what might be asked. Maybe I use my highlighter. I like to use a highlighter. Maybe the groups at highest risk, right? That's important. So we're talking about the consequences of poverty in rural areas. So maybe you're asked about who are the groups at highest risk? You have it right there. Children, minority, racial and ethnic groups, especially single parent families, and some other groups. And then we surmise that the Hispanic rate has increased the most. Okay, so there's information about who's at risk. And then we talk about education level. Okay, what are the effects of poverty on education level? Okay, so here's some information about that. So read each bullet, make sure you understand each bullet, and then think about what information are they giving me? What might they be asking? So you guys give me a example question of what might be asked about the consequences of poverty in rural areas based on the information we just went through.
Like what population has the highest like incidence for unemployment?
Yep. Or poverty. Right? What role does education play? Right? It's clear that the rural and migrant population are are not educated as well as their counterparts in the urban area. So what kinds of consequences or what kinds of barriers does that present to them? We know that poverty in the rural areas is very high. Okay. Another issue, number 2, the second bullet, is the physical demands of harvesting crops all day. Right? They take their toll on your musculoskeletal system. Right? Here's some information. Back and neck pain were the most common types of chronic pain. That's important. Right? So have a look at this bullet. So this is talking about the physical demands of the migrant worker. Okay. Identify health risks for clients in rural communities who don't seek care. What do we know about the rural communities? They don't seek primary care, right? Why? Why don't they seek primary care?
They could have like transportation issues.
Mm-hmm. What else? What are the barriers for seeking care in the rural population?
A lot of patients don't have insurance. Like,
Insurance is an issue. Yeah. Transportation is an issue.
Access to care.
Access. Yep.
To care.
Yep. Yep. What about most of the jobs in these communities are not jobs that come with holiday pay and vacation pay and personal days off and right. So if they have to take a day off to go to the doctor, what does that mean? They don't get paid,
Yeah.
right? They don't get paid. So another risk factor of them not seeking care, right? So obviously we can surmise that their lack of attention to seeking care is going to create overall health issues with this population, right? Okay, they're more at risk for accidents, they're more at risk for developing chronic diseases because they're not seen on the front end. Okay. And here's the last sentence of this. Chronic disease is more prevalent among rural clients. Okay. And the next bullet talks about the barriers exist. What barriers exist? And could pose an issue with these clients. Okay. So let's read it. Clients who live in the rural community know each other and are very familiar with each other. There's a lack of anonymity among rural communities, which makes reporting health issues a challenge. Right? Clients are much more likely to report sexual assault, drug use, or depression based on the concern that the others will find out. So what kind of question might be asked about this particular bullet? It's a big issue. This is a big issue in the rural community of lack of anonymity. And this is another reason why these clients don't come forward. There's a very high incidence of violence and sexual abuse and domestic abuse, child neglect in the rural and migrant areas. and they don't come forward until it's reached a crisis level, right? You'll see them in the urgent care and the ERs when things are kind of out of control. And this barrier is they don't go and seek care because they don't want everybody to know about their business. Right? So that's a big, big barrier with rural healthcare, is the lack of anonymity. Okay? And then another issue is the pesticide exposure. Okay, this bullet specifically asks you, review the primary and tertiary prevention of healthy people 2030 objectives regarding pesticide exposures. So go back to that chapter and review your healthy people 2030 objectives regarding pesticide exposure. And that would likely be in the migrant, that would be in the migrant rural chapter. Okay, so go back and look at that. But read through the rest of this. Kind of gives you a summary of what these objectives are. Okay, so what would be a primary teaching strategy for that you would use for migrants who are at risk for pesticide exposure? What would be a primary intervention?
Wearing protective clothing and using the proper equipment to maintain that.
Providing
The exposure.
information, yeah, providing information on pesticide exposure, how to reduce your risk to pesticide exposure. What are some secondary interventions? They're right in here in this bullet. Go ahead. Hand washing stations, screenings,
Lab
urine
work.
testing. What else?
I said lab work.
Remember, secondary is early intervention, early identification, early intervention. Okay, so screening. So we want to screen the clients who are at risk, making sure it doesn't develop into an actual pesticide exposure. And then what happens at the tertiary level? What has to happen for it to be a tertiary intervention?
They have to already be,
Yeah.
I guess, in this incidence exposed.
They have to have the pesticide exposure and they're actually presenting to you with symptoms. Right? Nausea, vomiting, skin irritation. So now you're having to treat the condition. Does that make sense? Next bullet is about the cultural considerations of the Mexican culture. How do we approach the Mexican culture with regards to their values and beliefs?
Socializing,
Right here.
socializing with them.
Yeah, it's right here. The answer to your question is all right here. According to the Mexican culture, the nurse is considered an authority figure who should respect the individual, be able to relate to the individual, maintain the individual's dignity. Okay. Mexican culture, like many cultures, expect to establish some rapport, develop a relationship, talk about personal matters for the first few minutes of the encounter before addressing any problems. To the Mexican population, touching as a caring gesture is usually seen as a positive behavior. So here's some information in this bullet about the highlights of cultural values and beliefs of the Mexican culture. Okay. So those are some of the key items to know about the rural and migrant population. And then we talked about vulnerable populations and health considerations. Okay, here's a pretty important statement here. Families with children are the fastest growing segment of homeless, not individual males, individual females, families with children. There's a lot of there's a lot of people at risk for homelessness, but let's say you get asked a priority question. What is the fastest growing population of homeless? And you're given single males, children, adolescents, families with children. Okay, this would be a specific priority question. What is that's what I'm thinking. I'm just trying to think questions. What would be the fastest growing population of homeless? Families with children. This next bullet talks about HIV. Okay, what is HIV? How is it transmitted? And this gives a lot of information. It talks about HIV is transmitted. Okay, and then it talks about people who are at risk. Okay, so a couple of different scenarios. Maybe some questions about how is HIV transmitted? And the answers are right here. That HIV is transmitted by intimate sexual contact, exchange of body fluids, exposure to infected blood, passage from infected woman to her fetus. And then who falls into the high risk category? Right here, individuals who use IV drugs, individuals who experience persistent recurrent sexual STDs, and people who have multiple sex partners. So do you see how I'm trying to break down each of these bullets? Look at the information that's been given for you and then try and formulate. Well, they're giving me information on how HIV is transmitted. So what might be a question?
Who's likely to get HIV?
Exactly. Or who's at risk for HIV? Well, there's three populations. IV drug users, recurrent STDs, and multiple sex partners. Homeless adolescents living on the streets have a greater risk of risk-taking behaviors. Okay, how does that look? Well, they have an earlier onset of sexual activity. They're at much higher risk for contracting serious communicable diseases, AIDS, hepatitis, and they're more likely to use alcohol and illicit substances. Next topic is about single motherhood. Okay, lots of information in this bullet. So again, this study guide is a summary. It's a summary of your readings. It's a summary of your PowerPoints. It's a summary of the lecture. And if you look at the objectives for each of the chapters for this exam, this information that we're sharing with you in a summary are objectives, right? So this is what you were expected to pull out of these chapters. So we're just summarizing it for you. Okay, so single motherhood, lots of information in here, right? We know that there's a direct correlation that exists between education and poverty. What's the most important thing to do with regards to single mothers and their education? What did you learn in class? What is one of the single most important things we can encourage for them? Stay in school, right? Remember that? Stay in school, right? We know that there's a direct correlation between poverty and poor health outcomes for this group. Poor teens are 3 times more likely to drop out of school. And so if programs exist to help the mother stay in school during her pregnancy, after she has the baby, when these programs exist, there's an increase, there's just an increase for a better future for both the young mom and the baby, right? Better education, better decision-making skills, better able to process things. And here's what I just said here in this last sentence. It's important to keep the pregnant adolescent in school during the pregnancy and have her return as soon as possible. So we're asking you here, know the dangers of mixing drugs and medications and alcohol. What kind of discharge teaching do you do with medications that are central nervous system depressants if they mix with alcohol? So we're asking you a very specific question here. Know the dangers of mixing drugs, medications, alcohol. What kind of discharge teaching do you do with somebody when they're on depressants and they mix them with alcohol? So if you can't answer that now, you need to go back to your readings and get that information. And then we know with this population, youth violence is an issue. Okay, this bullet deals with what can we do as a community? What can we do as a community to help decrease the prevalence of youth violence? We talk about creating partnerships with the community, helping them to increase social skills, working with the kids in the schools. Okay. And then one other bullet on homeless. Homeless people have the same problems accessing care as do others in poverty. Lack of money, lack of insurance, lack of transportation, right? Where do homeless people get most of their care? In the primary care clinics?
Emergency.
In the ER.
In the ER. And what does that translate into? Very costly. Next topic is alcohol, tobacco, and other drugs. Here, we're asking you specifically, review Healthy People 2030 concerns with tobacco and their objectives. So you need to go back to that chapter if you can't articulate those right now. So go back to that chapter, review that little box, the Healthy People 2030 box, and see what their objectives are for alcohol, or excuse me, for tobacco. What are the risk factors? What are some risk factors? And here we say what are some risk factors? Look back in the chapter for these key concepts. I have a typo in here. Okay. Here, review how psychological dependence can occur with chronic use of drugs. Review the benefit of harm reduction. There's a section in that chapter that talks about harm reduction. And then what are considered risk factors for the vulnerable to cause alcohol, tobacco, and other drug problems? Maybe mental health disorders, maybe genetic predispositions, maybe a crisis in the family, death, divorce, lots of risk factors. So what are the risk factors for the vulnerable to be causing substance abuse issues? Nicotine ingredients, please review that. Know the dangers of And how would a community nurse provide teaching on vaping products and exposure? So go back and please review that. What do we know about vaping? What is vaping if a client tells you that they stop smoking cigarettes and they're vaping now? Is that good? No.
Mm.
What in the I'm also thinking e-cigarettes too. What is the biggest risk for kids being around the vaping and e-cigarettes? What about the oils? Do you remember the oils? The oils are poisonous to kids. Right? Need to remember that. And then faith community nurse, home health nurse, hospice nurse. Review the definitions and provide examples of congregation-based, institutional-based model. Do you remember what those are? In the faith community, the congregation-based model is when the nurse is working with the congregation itself, right? The institutional based is when the congregation branches out and seeks partnerships in the community. Assisted living care, transportation, home health services. Everybody understand the difference between those two? And then if you review that chapter and know what some of the spiritual activities a parish nurse would include in interventions. The whole point of the faith community nurse is she still does her ADPI, she still does her, nursing process, but she adds a spiritual, whatever that religion is. She adds a spiritual aspect of care to the overall health plan. How does the faith community nurse act as an advocate and case manager for the patients? Here's Healthy People 2030. What are the differences of prevention, levels of prevention the faith community nurse practices following Healthy People 2030? So please review the Healthy People 2030 box in your faith chapter. Know the differences between religiosity and spirituality. Do you guys know those? Did you remember those? Religiosity is basically when we all come together in one congregation and practice the same religion. That's religiosity. Spirituality is whatever your view is of the higher power. Spirituality is an individual viewpoint of how you view things. Okay. And then review the nursing functions of hospice nursing. Okay. Go to your hospice nursing section of that chapter and review the functions. Okay. So I'm going to skip down to environmental health and epidemiology. Again, we're being very specific. Know the definition of epidemiology and how it applies to infectious epidemics. What's a case fatality rate? I mean, if you haven't looked at the study guide yet, this can be overwhelming, but this information should have been covered in class. So now we're reviewing it. Who individuals with immune deficiencies are at high risk for illness after consuming contaminated food or water. Okay, that's pretty important. What if you get asked a question about who is at risk? Who's at risk for potential environmental hazards of contaminated water or food? The answer is people with immune deficiencies. Okay. Review Healthy People 2030 for environmental health. So go back to your environmental health chapter and review your Healthy People 2030. What's the role of the occupational health nurse? What's an occupational health nurse? What is her responsibility? What is she looking after? The workplace, right? Occupational health nurse is responsible for safety, health and safety in the workplace. Review the principles of the epidemiological triangle. Do you remember those? The agent, the host, and the environment. And be able to give an example of each one. If you're given a scenario, you may be asked, here's your scenario. Are we talking about the agent, the host, or the environment? And then go back to your epidemiology chapter and just be able to simply define the difference between incidence, risk, and prevalence. There's a nice little summary box in your chapter. What's the incidence that something will happen? What's the risk that something will happen? What's the prevalence? Okay. And then right below that is the information on study designs. Okay, so a few study designs for epidemiological studies are ecologic, cross-sectional, and retrospective. There's a whole bunch of designs, but we're asking you to know about these three. Ecologic, cross-sectional, and retrospective. So if you're given a scenario and you're asked which design would be better, I can tell you for nurses, when we're doing I was in school nursing forever, and we always do. We were participating in epidemiological practices all the time, tracking pertussis, tracking chickenpox, tracking COVID. We always use the ecologic design. It's simple. Nurses use the ecologic design. Simple, it's quick, the data is available to you. Cross-sectional and retrospective can be helpful, but if you have a scenario in which the nurse is trying to do a quick study, quick tracking, quick assessment of what's going on, at least I did in the schools, I used an ecologic model. Okay. Here, what is the World Health Organization's mission and principles? And how does this apply to the Healthy People 2030? So as you're probably seeing, there's a lot of Healthy People 2030 information in the study guide, right? You need to know what the World Health Organization's mission and principle. What's the primary goal for World Health Organization? To promote health for all. Okay. And then the last part of occupational health, jumping back up there, this should be up, is what's the function of OSHA? Everybody knows what OSHA is, right? OSHA is kind of the enforcers, making sure that the workplace's safety is safe, right? OSHA, what if there's an accident? What if there's an unexpected death? What if there's an injury? Okay, they are there to enforce the rules and regulations, the health and safety regulations that is set forth by your occupational health person or department. So know what OSHA is. So that's how I would suggest you break down the study guide. Okay, again, if you haven't looked at it, and you're just looking at it now for the first time, it's like, oh my gosh, I remember that, but I don't really remember that. I have to go back and look. So you should be, if you cannot articulate each of these bullets, you need to go back to your chapters in your readings or your lecture and listen to that part again. Okay. Let's talk about some test taking strategies. Who's got, how do you guys prepare for an exam? What do you guys do?
I usually either do flashcards or do like try to make my own study guide based off of like this one.
Okay. Okay,
Same, I like to make flashcards, rewrite stuff.
okay. Remember, the study guide is a good starting point. Okay, this is a good starting point. You don't need to go back and reread all your chapters from start to finish. Okay, use this as kind of a starting point. If there are things on the study guide that you're totally comfortable with, and you can, take each bullet and think about questions. Okay, but if there are bullets or sections that you don't feel like you have a good understanding of, you're going to need to go back and do your due diligence of rereading that section. Look at that PowerPoint from that chapter. Okay. But you should, if you have a good understanding of the study guide and you can apply it, into the clinical setting, which is what a lot of the exam is about, is clinical judgment, right? Applying this knowledge into the clinical setting, then you'll be fine. You'll be fine. But don't overdo it. Don't overdo it. Don't feel like you have to go back and reread everything. Okay, this, like I said, the study guide's a good starting point. It's a summary that we've pulled from all your different resources. Okay, I'm not saying to only use a study guide. All I'm saying is it's a good summary as a starting point for studying. These are the topics that are going to be covered on the exam. And hopefully it's familiar to you. If you've been attending class and taking notes and paying attention and all that, right? So here's some of my test taking stuff. Do not change your answers. Unless you can convince yourself 100% why that's the wrong answer, feel free to change it. But if you are thinking, well, I think she said that in the review, I think she said that in lecture, I think I heard that or read that somewhere, that's not a good enough reason to change your answer. Okay, so don't change your answers. Okay, unless you read the question first and then maybe look away and not look at the answers and try and come up with your own answer in your head. Right, you read the question, oh, okay, it's about whatever, this is what I think the answer would be. And then look at the answers and see if there's something there that meets your answer. And that's probably the right answer. Okay, I don't know if anybody uses the highlighter, but a lot of students miss important cues in the questions. Okay, the priority questions, like I said at the beginning, what's the first, what's the most, what's the least, what's the priority? You got to reread that question. Okay, so students tell me they use the highlighter or use their whiteboard. And the first time they read the question, if a word jumps out at them or a phrase, they write it down or highlight it. Please go back and review the question a second time. Okay, if after a couple of times you still have no clue about the answer, make a guess and move on. It's one question. Do not sit on a question for 5-7 minutes, okay? What else do I have to offer? Take your time, take the whole 75 minutes, relax and take the exam. No need to rush through it. What are some strategies you guys use for exam taking that might be helpful to your peers? Anybody has some good strategies they do?
I know I use the highlighter, but there's also like a little eyeball next to each answer. And once you've like eliminated that answer, if you click that, it'll cross it out for you.
Yep.
And
That's
I also,
perfect.
yeah, I also like start from the bottom and like take the last answer and compare it to like, so I compare D to C. and whichever one would be more applicable, I keep that one and then compare D to B. And then,
Mhm.
so I guess process of elimination.
That's an excellent strategy. What about anybody else? Does anybody else have any strategies they use? Pardon me.
I like to look to see if any of the answers are like really similar to see, like, because if there's two that are the same, then most likely it's not those two. And I'd like to process and eliminate those.
Don't be afraid to select all that apply with all.
Oh,
Don't-
yeah.
Don't be, but there's a lot of students who do not, they'll select 4 of the 5 answers because they didn't possibly think it was all the answers. It can be. Okay, here's another tip. If you read a question and there's only one answer that's correct, it's not a select all that apply, and all the answers look like they could be in the ballpark for being correct, then you missed something in the question. Right? You missed what is the first thing you would do. What is the most likely thing you would do? So if all the answers are looking, I can only choose one, but they all look like they could work, then you miss something. Go back and reread that question. Because it may be asking for the most important or the first thing you do.
I was also told that if like a question says all of or none of, like depending on what it is, especially with nursing, most of the like 90% of the time, it's not going to be all of that. It's not going to be all of this or none of this, like
Or
that's not
never.
possible, or never.
Will never happen, or it always happen. Yeah. 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 I mean, these are not tricky exams. They're not trick questions. Okay. They're whatever. Here's something I had to talk to several students about this week. The information that you need to pick the appropriate answer is in the question. You're not expected to say, well, what if that's going on? What if that's going on? What happened? What if they did that? Don't overthink the question. All the information you need is right in the question. You're not expected to assume anything else outside the question. And that's called overthinking. And that can get you into big trouble. You know, I have a lot of people in other, like first responders, firefighters, EMTs, even LPNs, everybody, you just have to be careful. Okay. Not to bring all of your own practice outside into these questions. Try and take off those hats when you come into this community exam. Okay, what would you do as a community nurse? Not what would you do as an EMT, not what would you do as a first responder. Okay. You guys will be fine. The fact that you're here, that's great. What questions do you have for me? So do you have a better idea of how to break down this study guide? Okay. It's broken down into different concepts and then a summary of what's the most important things to know about each concept. Questions? Helpful? Is this helpful? Okay. You guys will be fine. What I tell my students, and I know that I'm sure other faculty offer it as well, but if you get close to the exam, I don't know what days you're taking it, but if, I tell my students within a couple of days of the exam, if you've gone through the study guide, if you've done your due diligence and all your research, and there are still some concepts that you're not understanding or you want to talk about more, just send me a quick message and we'll Zoom and we'll go through that last bit of information that you may be unsure of before an exam. Okay, so my point is reach out to your professors if at the end you're getting close, but there's still a couple of things that aren't clicking. Okay. Okay, ladies, that's all I have. I hope this has been helpful. Good luck. Whenever you take the exam, you'll be fine. You'll be fine. Okay?
Thank you.
Thank you.
Yeah, you're welcome. You're welcome. Yeah. Have a good day.
You too.
Thank you,
Thank you.
Professor.
Okay. Bye.
Thank you.
You're very welcome.